Will AI replace doctors?
Coming revolution in artificial intelligence.
Now, AI tools are being developed.
ChatGPT is the top performing doctor.
Very descriptive and gave you a lot of good information.
There's the whole idea of kind of the symbiosis where AI and human.
I have never even heard this. This is a great answer. So you get access to this early LLM.
When I was at Microsoft still, before I started Bionic, I had early access to some of the most advanced models. Nobody else in the world had access. Yeah, it blew my mind every day. And my brother-in-law, he was the picture of health. That dude is like 10% body fat.
Yeah.
Like he should live forever. And he has a heart attack and died. And it made me think, well, what about his doctor? The whole health system missed it.
What the hell is going on? Today I spoke with Dr. Jared Pelo,
a physician leader and digital health innovator.
Dr. Jared Pelo.
Dr. Pelo helps lead an ambient clinical intelligence team.
Chief Medical Officer of Bionic Health.
Bionic Health.
A new longevity clinic looking to bring personalized medicine to every person in the United States. This conversation has it all. Tune in for our first episode. Hey, Jared, how are you?
I'm doing good. How are you, Kian?
I have Jared here today, Jared Pelo, Chief Medical Officer of Bionic Health. Bionic Health is a longevity clinic, and several months ago, Jared actually reached out to potentially finding a genetics partner. A lot of people don't know this, but our informatics laboratory at Nucleus is in North Carolina. So we actually have an office down here. So every once in a while I come here, and then, of course, Jared, you live down here, right?
Yeah, just live around the corner.
Okay, great. Wow. So it's literally 5 minutes or something?
That's right.
Are you serious?
Yeah.
Oh, wow. So that we picked the perfect spot for you.
Oh, it's perfect. Yeah.
Oh, amazing.
Yeah.
So Jared and I both, I think, have the same vision. We want to build kind of a real-time, consumer-centric, quantified health system that lets people prevent disease and just live longer. We know that life expectancy has doubled in the last 150 years or so, and I think with both Nucleus's work and also Bionic's work, that's the goal as well, right? How would you kind of describe what your mission is at Bionic?
Yeah, I mean, we say optimal health for all, and we literally mean every human on the earth deserves the opportunity to live as healthy as possible for as long as possible. And I mean, we're a long ways from that, and I don't know if we'll accomplish it in our lifetime, but what a cool thing to work on for a lifetime.
Yeah, and you're a doctor, right?
Yeah, so an ER doctor. So, I mean, I spent time saving lives, which was super cool. But what was not cool is usually people were coming in and I was too late. They came in, they had their heart attack. I couldn't do anything to change that. They came in, I diagnosed them with cancer. That totally sucked.
That's horrible.
And so, I wanted to go closer to the problem. Could we not wait until somebody's broken? What could we do to fix things before they ended up in my ER, waiting for me to save their life? Could I make it so they never ended up in my ER?
100%.
So that's what it's all about.
100%. And so, I want to talk a little bit more about this origin story. So you've spoken about before how there's a personal tragedy that you had in your life that had you rethink healthcare. Can you talk a little bit about that and, kind of what happened and, what was the change?
Yeah. So my brother-in-law, he's one of my best friends. He married into my family when I was 10 years old, played basketball with him a ton, went to all our football games together, huge sports fan. And we were always trading health recipes. You would have thought this guy, he watched Rhonda Patrick with me and made green smoothies. And if you've tried that green smoothie, you know how nasty it is, but he would drink it every day. And he was a competitive mountain biker. And we had just gone to the beach together in Outer Banks, North Carolina. And when we were there, he's like, Jared, I just feel like I'm not as strong on my mountain bike. And a month later, he's riding through southern Utah, beautiful desert, and he has a heart attack and dies.
Oh, my God.
And I remember the moment that I heard the news, how heartbroken I was. And then I remember thinking back, hey, he told me he wasn't feeling good. Did I miss something? And it made me think, well, what about his doctor who missed it? And what about the whole health system missed it? This guy, he was the picture of health. If you'd seen him on the street, you would have been like, that dude is 10% body fat, VO2 max through the roof. He should live forever, but we missed it. And so how did healthcare fail him? And it's because healthcare didn't understand his risk. He didn't understand his own risk. His doctor missed things. He didn't get the right data. He didn't get a calcium score, a CT angiogram. I think if he had done his genetics, Like his dad died from a stroke.
Really?
His brother died from a heart attack. Like I have no doubt that there are some genetic things there for him. And so, yeah, there's so many ways that it was missed. And that was kind of one of those moments. Take my time in the ER and feeling like I was always too late, and then take that tragedy of my brother-in-law's passing. And I was just like, this has to stop. Like
So that was like the straw that broke the camel's back
Yeah.
then.
Yeah.
Yeah. So it's like once you have a prepared mind, you have this experience as a doctor, your brother-in-law suddenly dies of a heart attack. And at this point, you're like, holy shit, I need to figure this out.
Yeah.
But it's a hard problem to try to figure out.
Oh, yeah.
I'm curious. I know that your mom had an interest in alternative medicine,
Oh,
right?
yeah.
Yoga, Reiki.
Yeah.
How did that play into your thinking? And there's always this. We could have a whole nother podcast on kind of integrating Eastern and Western medicine
Yeah.
and thinking about that. But has that informed your work today as well? How do you think about that?
Well, I mean, it really opened my mind to like the possibilities because I grew up, like I would get sick and my mom would get a reflexologist to rub my foot. Right.
And would it work or?
Oh, no. but like there were people it seemed to help. And so what it opened my mind to is, do we always know everything in science? And in medicine, a lot of people think we know it all and we don't. And I mean, I think genetics is a great space because we're still learning so much. Like it is early.
Really
still,
early. Yeah.
Still. But my mom's history of like doing all this kind of outside stuff, outside the norm stuff, just made me realize like you always have to be open that you might be missing something, that you don't know everything, that there might be a better way to do things.
Yeah. Was there ever a moment where your mom introduced you to some, I don't know, yoga, Reiki, something that actually materially changed like, some sort of feeling or behavior that you had? I'm curious.
Well, I do credit her a lot. Like, I mean, she got me started with like mindfulness meditation when I was like a teenager.
Which is critical. I meditate a lot as well. You meditate? Do you meditate every day? Or?
I do.
Okay, yeah. It's. I feel like it's still underpriced and right. Like it dramatically shapes your just entire being.
Yeah, and it's not the easiest thing to do.
No.
But
it's a skill.
Even if you just do a few minutes a day, it makes a difference to like ground yourself and just be like, okay, I'm sensing the world around me. And not everything that is happening in my head is true and important.
Yeah.
And just experience life. Like it's so important to reground yourself.
Yeah, agreed. And then okay, let's go back to your brother-in-law for a second. So your brother-in-law, has this tragedy. What's the time period from that tragedy? And you're obviously still in the ER at this point, helping patients. Is there just, what is it, a year, 2 years, is it 5 years? Help us on the timeline here.
Yeah.
What point are you like, I can't just, be treating patients who are dying or sick. I need to go way upstream and prevent in the first place people from dying. Walk that through with me a little bit more.
Yeah. My timeline's kind of funny because I wasn't in the ER at that time.
Oh, okay.
I got into health tech 10 years ago.
Okay, wow.
And I built a company where we recorded doctor-patient conversations and then built AI to write doctors' notes. And Microsoft owns that.
Wow, so you were ahead of the game in AI.
Yeah. So, the OGs in the space, there's a guy at Commure now, Ian Shaquille, and he started a company called Augmetics, and then I started a company called iScribes, and we built like the first large language models in healthcare through Nuance Communications, and then Microsoft owns it.
How'd you even come across it at the time? AI was not, something that it is today. It was a little bit more niche. What, how'd you come across that? Yeah.
I mean, that was just the belief that it would come.
Wow.
My company really just gathered the data. And so me and my co-founders, we just started recording doctor-patient conversations, and then we would have people working from home across the US that would write notes for doctors. And then we sold that to the makers of Dragon, which is like a speech recognition company. And they took their researchers and actually built the AI to write notes.
And then what year did you sell that company?
We sold that in 2017, which was perfect timing because that's when transformer models started.
Yes.
And the rest is history.
Okay, wow. So, now we're talking about AI.
Yeah.
Which, is all the rage these days.
Oh, yeah.
But it looks like you were actually in AI way before, people even knew OpenAI.
Yeah.
Did you by any chance, get in any OpenAI stock at the time?
Yeah, I should have. I could have done so. I don't think their stock's available, actually.
Maybe it's in some private market. You call up one of your buddies, I don't know. Maybe you make like, no secondaries? Okay.
Yeah.
But now, AI is, as mentioned, older age. And I think the top question in a lot of people's minds, and I get this question asked a lot, and you're a physician.
Yeah.
My dad's a physician as well, so I always feel like you guys can almost speak best on this topic. Will AI replace doctors?
It will replace things some doctors do.
Okay. Give me some examples.
Yeah. So, I mean, I think there are, well, and also things they don't do. So, like, no doctor really coaches you on nutrition or fitness. They don't have time.
Yeah.
And so AI will absolutely coach you on nutrition and fitness.
Yeah.
No doctor is going to read over a DNA report. You might talk to,
That's true.
right?
That's true.
And you might talk to a genetic counselor. And if you're seeing a geneticist, you're past the DNA report, right? And so, like, no doctor can take all the data on you and synthesize it. And
True.
so these are all things that doctors can't do that AI will do or does today. And then, I think easy communication between doctors' offices and patients will be taken over by AI. But I think the actual delivery of care, like the connecting with the human being and, holding somebody's hand while you tell them that their loved one passed or while you talk to them about their cancer diagnosis, I think that will always be human to human.
So you think the kind of remaining frontier then of delivering of care that a human does will be the empathy, effectively? You think that's true?
Yeah.
Is there any medicine though you think that won't be replaced by an AI, that a human being will actually be better at than an AI?
Well, I think, there's the whole idea of kind of the symbiosis.
Okay.
Where AI and human, like an AI chess and a human chess will beat a AI chess, right? Like together, it's better than one alone. And so I think 5 years from now, a doctor will not practice without AI.
Okay. Wow. 5 years.
Yeah.
Okay. So, let's go through, like, my dad's an ophthalmologist. You said you were in the ER. Obviously, different, doctors have different daily workflows. So let's go into like being an ER doctor, right?
Yeah.
If you walked me through your day and then tell me in each step of your day, kind of each phase of your day, what specifically do you think AI would change?
Yeah.
Yeah.
So say I pick up a patient and I'll give a typical patient. So this is like a 56-year-old with chest pain.
Okay.
Like an AI would summarize their whole note. And maybe if I had the data, it would pull in interesting things like their genetic risk of a heart attack or all these things.
Okay, so a patient comes in, right, and it basically takes its EHR, right?
Yep.
So there's some AI sitting on top of Epic, presumably, or something like this,
Right.
and it takes all this data. It gives you a very clear synthesis of, the patient history, drugs they're on, their genetics, blood, whatever else is needed, and you do a quick scan, and then that will basically help you make the actual diagnosis of what the hell is going on. Is that correct?
Yeah, well, even kind of give me what's called differential diagnosis, which are the possible diagnosis for this person. And it should even rank order, like the risk of each of those. And it should even start guiding me, like, these are the tests you do to rule out each of these things. And then it's a conversation between me and a patient. Because one thing I tell people is doctors are salespeople, especially ER doctors.
Interesting.
You walk in and you have to sell this person on the workup that you think is best to rule out all the bad things happening in them. And so, yeah, that's exactly, and that AI does not exist today. Like, that's not built into Epic, but it needs to be.
Yeah.
So that's the type of AI that will.
And do you think it's gonna be Epic that could do you think Epic will actually do this? Do you think this is like, what do you think? What are your thoughts on that?
Yeah, I mean, there's a ton of startups working on this.
Yeah.
And Epic is working on it. And
Yeah. And
so,
Epic has distribution. Distribution, as we've discussed today, is king.
that is correct.
So you think Epic wins that out?
I think Epic wins in the long run.
Yeah.
Yeah, I think there will be startups that pop up and that are interesting for a little while, and then Epic will kind of destroy them as they roll out the.
So you really kind of paint a narrative where the AI is complementary to the doctor.
Mm-hmm.
The AI will give the doctor kind of, almost help the doctor through this kind of possible outcome space, right?
Yep.
I always say there's a tree of possibilities. You run different tests, get back information. Then with each marginal piece of information, the kind of collective possibilities get smaller and smaller and smaller.
That's right.
Right?
Yep.
Why can't an AI do that though?
Well,
Right? An AI,
Yeah.
you get in the ER, and then the AI knows everything, right?
Yeah.
It has some autonomy. It
Yeah.
says, oh, it's probably this. It orders a test, right? The different kind of testing, the different diagnostic and lab testing, that's not done by the doctor. There's some infrastructure that does that, right?
Yeah.
It guides the patient on where to go. What do you think about that world?
Well, I think it's possible that world comes.
Yeah.
I would say I think about automated physicians a lot. And let's just look at like self-driving cars.
Yeah.
Right? So Elon just announced full self-driving 13.2 or whatever, and it's going to blow all our minds. And I watched the YouTubes on it. But as soon as that full self-driving kills somebody,
Yeah.
it'll make news, national news, world news.
Yeah.
Right? Although, like Johnny down the street who just got his driver's license and goes and kills somebody, that will just make local news.
Yeah.
Like it's not as nearly as big of a deal. And so it's possible that the day comes where we trust AI to deliver medical care, but it has to be perfect because we don't like the idea of machines making mistakes that kill people, where we're much more comfortable with humans making mistakes that kill people because that happens, every day. It's about the same as two 737s falling out of the air.
Crazy.
And dying because of mistakes made in the hospitals.
Wow. And that's probably not even just the injured patients because
Yeah,
there's
those
a
are
lot more that are
deaths.
injured.
Those are
deaths.
deaths per day in the U.S.
Because, my dad always says when he does, cataracts, it's always like, which eye? And he always jokes, it's like, every once in a while, doctors will get it wrong.
It's 50-50.
You're like, oh, it's the right eye. And they're like, right side. I think this is the, they look at the patient and they're like, literally they do this check. Like, okay, right. Okay, good. That eye, right.
Yeah.
And they check the nurse's
And
work.
everybody in the room, everybody checks.
Yeah,
like,
everyone
right
checks.
check, right check, right check.
Exactly. Jared, you said that you just said that doctors can provide more empathy to the patient when delivering care. I saw a study that said that actually it was almost a quote unquote double-blind study where they gave patients recommendations, some sort of care, and they found that the patients almost always chose the AI as actually having more empathy than the doctor.
Yeah.
How do you think about that? Do you think that kind of makes you question your fundamental assumptions on this? Or tell me more there.
Well, I mean, those are text-based. It was a text-based study, so it was like auto response or responses to messages, which is interesting. Like, how much empathy do you usually feel from a text? And what I'm talking about is really like empathy to change who you are. So what we know from other studies are that you're more likely to change your habits if a doctor tells you that you need to change your habits when you're with them.
Relative to what exactly?
Relative to, say, there's zero intervention.
Okay.
Like you should start exercising. And you go to a doctor, one doctor says you should start exercising, another one says nothing.
Do they have an AI in there though? Is
No,
that one of the
no,
they got to test that.
But how do you test an AI? The corporal, like the
You're saying like
the
in
body,
the physical plane.
The physical plane.
So what if we put ChatGPT on one of these humanoids? And then, right? Would you think that's a real possibility or?
Yeah, I mean, maybe in the future.
Well, it's almost one of those things where it's like when you go to a restaurant, I still feel like people want people to serve them, even if a humanoid could, you don't want it. And maybe there's this world where some kind of McDonald's, for example, they're going to probably have fully kind of as automated as humanly possible.
Yes.
But then as you go higher up in the kind of care, you'd imagine that there's going to get more kind of concierge, human based. So maybe there's this world where there are humanoids and they're kind of mass distributed in healthcare, but there's also still kind of a almost concierge like doctor. Do you think that's going to happen or?
I think it's going to be really interesting to see. There's already this movement, right? Like human made art is way more valuable than computer made art. Like computers can make like masterpieces now in a matter of seconds, and we're like, oh, that's just garbage.
Yeah.
Where if somebody painted that by hand, you'd be like, oh, that's amazing.
And people still watch people playing chess.
That's right.
Something that I think gets missed a lot. Like,
That's right.
And we all know AI is best in the world of chess. It can beat can beat anyone.
Yeah.
Magnus, Carlsen looks, not good, but we still will go on chess.com and we'll watch people playing chess. And same with Go as well. Go, it was a huge earth-shattering thing that AI could beat all these other humans. But then guess what? Boom. We still play Go. And so maybe there's something similar to that in medicine. I don't know.
Well, the other thing that I would say is it also depends on what's the alternative. Mm-hmm. So if there's no doctor around, like an AI doctor is amazing, right?
Yeah, that's true.
But if you live in America, if you live in the U.S. and there's a doctor, and especially if it's a doctor that connects with you on a personal level, like you feel like they care, they know who your kids are, they remember your dog's name, and they're the one that's breaking bad news and helping you through your cancer diagnosis, like that's totally different than.
So then doctors are becoming more psychologists, maybe.
Well, maybe.
I mean, there are already a little bit
Yeah.
psychologists, a little bit therapists, right? I mean, delivering news, bad news is like an art, and there's a lot of empathy, a lot of, the
Yeah.
quote unquote bedside manner, right?
Absolutely.
Right? That's a
Yeah.
huge component of being a doctor.
Yeah, the human side.
Maybe that's a world where it's like, it's not actually they can, take all this data and make the best, diagnosis, but maybe there's a world where it's just that it does give it to the human to relate to the patient because the human being appreciates so much more versus a cold machine.
Yeah.
Right? There's something to that I think that is fundamentally correct. I'm curious in the context of Bionic, was there ever a time, or even I guess in your own personal kind of healthcare journey, where you used AI in the context of your healthcare and it completely blew your mind, and you're like, holy shit, this is now possible with how good LLMs are, and it wasn't previously possible. Anything like that?
Oh, I mean, so when I was at Microsoft still, before I started Bionic, so I'll give you a little bit of a timeline. So my brother-in-law dies in November. Bionic starts in March the next year.
Oh my God! Wow.
So it was pretty quick. But during that timeline, I had early access to some of the most advanced models. I'm signed something, so I'm not able to say what they were, but you can imagine the names of them. And nobody else in the world had access except a few people at OpenAI, whoever OpenAI was letting have access, and then some people at Microsoft. And it blew my mind every day where,
okay. So you get access to this early LLM, right? This is still a secret in society.
Yeah.
I like to say that the best things, the best kind of frontiers of science are always secrets at first,
Yeah.
right? And in a small group, people always understand it and know it before it proliferates to the rest of society. So you were one of these small group of people who understood this.
Yeah.
You kind of, we all kind of play with ChatGPT at this point. What did you do? What was your first 10 queries? What did you kind of test and experiment? And then what couldn't you do then that you could do now?
Yeah, I mean, a lot of it was giving it test questions, like medical test questions, or
Do you remember any specifically?
well, I mean, a lot of them. The New England Journal of Medicine has like all these like interesting cases, and I would go find those old interesting cases and throw it in there. I would go try to find things that were
Did you know if it was trained on it though or not? That's the thing.
That is a good question.
we didn't
So
know.
I would go try to find things that were pre-internet
Okay, that's smart.
and then type them in and ask the questions.
How to do?
I mean, not always perfect, but
Yeah.
really, really good. I mean, just like it blew everybody's mind when they started chatting with ChatGPT and they're like, this thing's actually kind of smart.
Yeah.
It was, surprising.
So Ilya has this great little anecdote, when people ask him like, oh, how intelligent is, LLMs really? He always says that if you think about like, because some people could say, oh, it's just predicting the next word,
Yeah.
right? It's just like
Yeah.
statistics, right? Which,
Yeah.
our brain is just statistics. But anyways,
Yeah.
and he likes to tell the anecdote of there being like a detective story. So let's say there's a 400-page long detective story, human beings reading it. At the very end of the book, it basically asks the question, who did it?
Mm-hmm.
And then you have to think about and reason about all the different pieces of information that, you were given, and then, predict the next word.
Yeah, think the
In
next
other
word.
words, that's thinking, that's
Yeah.
reason, that's logic. And
Yeah.
so I think it's kind of similar, it reminds me of what you're saying now, where it's like, you have these pre-internet case studies, right? You give the AI a bunch of, information. Solving that next word is a lot more than just, oh, I think it's this next word, right?
Yeah.
There's something there out there that has to do with understanding, right? To actually be able to predict that. Do you think that's correct? So like, and then the meta question there is like, how like smart do you think these LLMs are?
I mean, I do think that is correct. Like that's how I think about LLMs is how do human brains work? Like I'm literally predicting the next word all the time.
Yeah.
and so I think, and that's the whole thing about neural networks. They're built on top of the idea of biologic like neural networks. And so, and then how smart are they and how smart will they get? It's kind of like humans. It's funny because we'll talk about like, oh, this LLM isn't that smart because you have to give it a tool. Like this LLM isn't very good at math. You have to give it, code interpreter, or you have to give it a calculator. But like as a human, like unless you're the super expert, fine-tuned to be able to do that, you need a tool to do it.
Yeah.
And so I think the LLMs of today are extremely capable. If we did not develop, if they were no more smart after today, I still think they will revolutionize the world.
I think so too.
If they made no further further advancements.
Yeah. Well, so we're talking about the glowing aspects of AI. Is there a time where the AI that you used or you've seen in healthcare completely fucked up, that someone actually was hurt by it?
I've never seen anybody hurt by it.
Okay. That's good.
And and that's partly because we keep humans in the loop.
It's conservative.
Today. Yeah.
But do you think that's going to happen? I mean, you kind of alluded to this earlier with the kind of Waymo analogy.
Yeah.
Whereas at some point something's going to go wrong, and then do you think there's anywhere in the United healthcare system where AI is being deployed too quickly?
I haven't seen it.
Okay.
Mostly just because we keep humans in the loop still. Because here's where humans or AI could start to hurt people is when it can prescribe medicine and prescribe treatment without a human. But that's when we get to the point where can they start replacing doctors? And so when AI can start to prescribe medicines, that's when the risk goes way up.
Do you think the medical establishment is prepared for what AI has coming?
Medical establishment moves so slow.
Yeah, they move. Yeah, yeah.
I think they are prepared because they will slow it down.
They are prepared because they'll slow it down.
Yeah, exactly.
They're like, all right, yeah, we're ready for this. All right, like let's add 10 layers of red tape in here.
Exactly.
By the time AI is deployed, it's like, we have AGI running around,
Oh, 100%. Like we will have such great services with AI all around us that still won't be in healthcare. Like, yeah.
That's sad though. I feel like our job is to solve that.
I mean, that's what we're working on, right? That's what you're working on. That's what we're working on.
Yeah. Let's keep going then beyond AI. I say beyond AI, but really it ends up being kind of, the big O is omniscient, omnipresent, omnipotent, right? That's also how they describe God. But anyways,
yeah.
Bionic Health. It's your baby. So you're an entrepreneur. You've been around the block. You started Bionic Health as kind of a longevity clinic. As I said earlier in the podcast, that's how we kind of originally met. You reached out about potentially, us serving you genetic testing. What's been the most surprising thing scaling up Bionic Health? I think you said you've done this for a while now. How many years has it been?
Yeah, we're almost 2 years in.
So it's 2 years in. What is the thing that made you go, what the? I would never have expected this. This totally surprised me about, scaling up a startup, about, building some sort of longevity clinic. Any specific anecdote that you have?
I mean, it's been way harder than I thought it was going to be. Like, selling my last product, iScribes, which was the note writing software, like that was easy. Because you go to a doctor and you're like, what's the worst part of your day? And they'd say writing notes. And you're like, great, I'm going to make that so it doesn't exist. And they're like, oh, perfect. So, I'm a huge Peter Attia fan, like big into longevity. And so I thought, there are all these people out there that as soon as I tell them, like, you can get the same kind of care that you could pay Peter Attia $150,000 for, you can get it for $1,500.
And on that point, do you want to find, kind of medicine 3.0?
Yeah.
Right.
Yeah.
What does that mean?
To me, it is, first defining the problem. So the problem is you want to live longer, healthier.
Okay.
And it comes down to two variables on how I think about it. First, don't die. So
Brian?
Yeah.
You listening?
Yeah, Brian Johnson. Like, first, don't die, which means identify your disease risk, understand your disease risk, and prevent it.
Yes.
And then number two, stay as strong as possible for as long as possible. If you do those two things, you're going to be living long and healthy. And really that's the philosophy of Bionic Health is we're going to help you understand your disease risk. So get the data necessary for that, help diagnose you, give you the treatments if we need to mitigate anything that's happening in your body. And then we're going to help you start exercising and eating healthy and doing all those things you've been putting off.
Yeah. And I like what you said earlier too, about taking, some sort of super personalized care that Peter Attia gives for whatever, $100,000 per patient, and then softwareizing it, productizing it, put it in an application that anyone can type into Google or OpenAI, and then go, onto the application and get the same kind of holistic care assessment. Because I like to say that, medicine is today it's just really bad data science.
Yeah.
Right. Really, it's about quantifying as much of the human being that we can at the molecular level, whether it's your Apple Watch, whether it's a blood test, with the genetic test. It's not or, it's and. It's all these different data sources, and ideally flagging some sort of molecular abnormality prior to a phenotypic signal, right? Because before, your brother-in-law actually died, there was some, you actually mentioned this, there was some phenotypic signal. He said to you, I'm not feeling well.
Yep.
But even more than that, if you actually looked at his heart, you would see something even more interesting, right?
100%.
And so you could have, to your point, entirely prevented it. Has there been a case yet where Bionic Health has saved someone's life?
Multiple.
Wow.
Yeah, like 25% of our people discover some major thing.
Really?
going
How
on.
do you define major there?
It's something that I would say is going to shorten your life by a decade or something.
Wow.
Right.
What's an example?
So this is advanced coronary artery disease or early cancer, or metabolic disease that we reverse. So it's one of those things.
Wow. And then have they come to you and said, thank you so much, Dr. Pelo? Like what do they say to you? Are they?
Oh yeah, I mean it's totally life changing. That's why people don't churn. Like nobody leaves Bionic Health. Like people keep sticking around and are happy to pay for it, and we get amazing kind of word of mouth. That's mostly how we sell, right?
Yeah.
Or like
best way. CAC really low.
Yeah, exactly, exactly.
What do you think about recently, as I'm sure you saw, a Penn student named Luigi. He murdered the CEO of United Healthcare.
Yeah.
Okay. This was obviously national news, so I'm sure you've heard about it. And it sort of kickstarted a conversation in society about, insurance, kind of bad incentives, healthcare writ large in this country. And my question for you is, do you think that the medical establishment is so incentivized to keep kind of, medicine 1.0, 2.0, that the activation needed to go to 3.0 is almost kind of impossible? Like how strong do you think that establishment incentive is, especially with insurance companies?
Yeah.
And then related to that is like, thoughts on the murder. Like I'm just curious, like thoughts on your perspective. Like, do you think it's a kind of good way to get the message out there? What do you think?
I'm generally a pacifist, so I don't think the murder was the right way to get the message out.
Agreed.
I do think the reaction shows us that our country wants change.
Yeah.
And I absolutely believe the payers are the worst part of our healthcare system.
Really?
Yeah.
Tell me more about that. Why?
I mean, as a physician, this happens again and again where you want to deliver care and you're stopped.
Yeah.
You want to help this person and you're stopped. And that's super frustrating. And then you'll see, the United Healthcare CEO did an op-ed after the murder and talks about how healthcare needs to change. And he talks about how it's payers' duty to make sure healthcare dollars are spent correctly. And that's absolutely not true. It is not their duty. That's how they make money, is by denying care. And I'm not saying that everybody that works for a health insurance company is a bad person, because not everybody knows what's happening. But I think our country would be far better served. And I know in our free market, people don't love to hear this, but I think there's ways around it. We would be much better served to have a one-payer system where we had universal health care.
Expand more. Why do you think that?
Well, one, they just released this week the amount of money we spend on healthcare. And
what is it, $4 trillion or something?
Yeah.
Something
and
like
it's
crazy.
like $14,000 per person.
Which is insane.
Where's
that money going?
Yeah,
God.
Exactly. What benefit did you get? What benefit did I get? And there are crazy decisions we make. I mean, it's crazy being in the ER and, an 84-year-old comes in and they have advanced cancer and they tell me that I'm supposed to do whatever I can to save their life. And we should make rational decisions as a society to say, if you're this sick, we're not going to put you on a ventilator for 2 weeks so that your family can, decide to then pull the plug. Like, we just spent $1 million on those last 2 weeks of life. Like, let's make better decisions with how we spend our money. But there were discussions about this when they passed the Affordable Care Act, and Republicans said they were death panels and they were the worst thing ever. But it's just smart. Like, we spend most of our money in the last 2 weeks of somebody's life. And if they're
crazy.
Over a certain age, and we're all going to die. Like, I understand that Brian Johnson, doesn't want us to all die, but we're all going to die, at least right now, until something new happens. And we should be smart about how we spend our money. And it would be way better to spend our money preventing us from getting sick than spending our money, like, once we're sick, to extend our life by 2 weeks.
Yeah, I think there's some statistic that's like, 95% of the expenditure is from like 5% of patients or something. I might be misquoting it, but basically this idea that, if you're sick, it costs a lot of money.
Yeah. Yeah.
And so it's actually in all our interest, even the insurance companies. That's the thing that drives me really crazy. If you look at like Medicare, for example, they will only cover a genetic test after you have cancer.
It's crazy.
I mean, what?
It's crazy.
I mean, like that you would think like, it's not even like, oh, like these people don't know. It's like that there's something perversely wrong with that at a fundamental structural level. And United Healthcare, if you look at it for a whole genome test, right, where we work together, we give whole genome patients, we give whole genome results to adult healthy patients with the entire goal of identifying their risk to then obviously preventing the condition that they're dying of. United Healthcare will say, oh, okay, you want a genetic test. Forget about a whole genome test. I'll put that aside for now.
Yeah.
Focus on just a gene panel, old school genetic test, right? Your genes, for people who don't know, there's genetics, as Jared mentioned, is like a 1,000-page book. And old genetic tests would look at maybe 10 pages in this book, maybe 100 pages. Now with whole genome testing, you can look at all 1,000 pages. So it's a much more comprehensive read. But even if we look at old genetic tests, United Healthcare will say, we will only cover this genetic test. That could potentially save your life, by the way. I like to say a swab can save your life. We'll only cover it if you have a family history of this condition. Here's the problem. More than 50% of hereditary cancers, there's no family history of the condition.
Yep.
Right? And also, not to mention, people don't even know what they have.
Yeah.
You have no clue.
Yeah.
Right? So even if it was in the medical records, right, which 50% is not, but even if it was, it doesn't actually get passed down. And it's a very fuzzy metric. What it actually means to be at risk. A lot of people don't know that someone could actually have at risk. It could be for a entirely different reason that was purely environmental. You don't even know if you inherited it. Anyways, so it's a really, really bad proxy. There's so many different pre-authorizations you have to get to even get one of these. Again, these are old school genetic tests.
Yeah.
Whole genome test, United Healthcare says, okay, yeah, we're happy to cover a whole genome test. If you are a baby that has just been born and is dying, literally dying, is debilitated in some fashion, and there is no other diagnostic test that has made clear what the baby has, then the insurance company will cover a whole genome test. Well, we, by the way, provide for $399, and that price, as we know, has come down by an order of magnitudes in the last 20 years, and it's going to be negligible. Something's broken. Something's fundamentally broken.
Yeah.
And so I like to always, someone asked me this question recently on a podcast. I'm going to ask it to you because I think it's a good question. Is if you could throw everything out, right? You are the master of the universe. You're the George Washington of healthcare. You could rebuild everything from scratch. How would you kind of design and build the healthcare system? Tell me about this. What would it look like? What would it be like?
I don't presume to be smart enough to do that. Like that is, healthcare is complicated and human health is very complicated and the systems are very complicated.
Yeah.
That being said, I still if I were to take where we're at today and change it wildly, I would do Medicare for all.
Okay.
I mean,
wow.
It already covers a huge, 40% of our population is covered by some form of government insurance. And so I would expand that to everybody. And then we've already been running this trial in Medicare. It's called Medicare Advantage, which are privatized Medicare plans. And so they are for-profit plans that are funded by Medicare, and they're wildly successful. And so, and that gives the consumer the opportunity to choose who they're going to get their care from. So I would do Medicare for all, and Medicare Advantage would be something that anybody could build a company around. We would have so many startups, building companies around delivering care. And that's where I would start. Okay.
And then are there any specific diagnostic tests or lab tests that you think should be ubiquitous?
Yes. I mean, I believe whole genome.
You think whole genome?
I believe whole genome. I mean, it's not the only test,
yeah,
right?
For sure.
You actually need the biomarkers. You actually need the imaging.
For sure.
You need all those other things. But I think, why not? We have the capability to do it at scale now. Why wouldn't we do it and have everybody have their genome?
100%. And, a lot of people say, oh, I'm worried about health insurance getting access to it. It's illegal. Genetic Information Non-Discrimination Act 2008, it's actually legal to do that.
Yeah.
Right? And also, the test could save your life.
Yeah.
What's the point of insurance if, you die of a condition, you're very young, right? Yeah. There's no point anyways. So I would agree there, and I definitely think to kind of reemphasize that point, too often I think in healthcare it's like this or this or this, this test or this test. Sometimes people ask me, this test or this test. No.
Why?
Yeah. You need more data.
Yeah.
The more data, the merrier,
yeah.
right? And all of this data is going to be trained into an AI that's eventually going to be, again, flagging these kind of molecular aberrations prior to a phenotypic signal. We know that's kind of where healthcare is going. And so if you can start gathering the data today and your genome doesn't change, it stays the same too.
Yep.
So, babies should be born and their genome should be sequenced. Common sense.
Yep.
And, I think there's this tension between kind of the healthcare establishment and Silicon Valley. Very different philosophies, right? I run into this sometimes. Doctors can be conservative. There's the Hippocratic Oath, going all the way back to ancient Greece. Do no harm.
Yep.
Do no harm. I don't necessarily think is Silicon Valley's expression. Right? Do no harm is one fundamentally about conservatism, right? Of course, do no harm can actually do a lot of harm. Do you agree with that? You think in medicine?
You mean being slow to change?
Yeah, slow to change, and sometimes even being so resistant to kind of frontier technology that the patient ends up actually getting potentially hurt. Right? Maybe they should try something new, but they don't because they don't want to do any harm. Do you think that's true? Do you agree with that, or?
I mean, possibly, because here's the thing: in medicine, everybody wants a double-blinded study. They want what we call evidence-based medicine.
Yeah.
And of what we practice today, it's probably like 20% is actually evidence-based, and the other 80% is like tradition and what we've done. And so it's kind of silly to think that we're always going to have evidence-based medicine. So when something new comes, everybody says, show me the evidence.
Yeah.
When we're already...
And just to be clear here, the evidence is not just in the fact that it works.
Yeah.
It's actually in the fact that you can do something about it. Right. You see this a lot in genetics, right? Where people will say, show me the evidence. And you say, well, look, this model can, one end of the bell curve is 3%, on the other end of the bell curve is 30% risk.
Yeah.
So 10x different in risk.
Right.
And it could be really independently validated, independent cohort, right? We know this model works. And then you'll get from some, institutionalized doctor, and they'll say something like, well, risk stratification. I have one of my most notorious examples is when I was pitching one of the largest, most famous clinics literally in the country, probably in the world. And then there was like the head of genetic counseling there, and I was telling them about polygenic scores. Right? Polygenic scores are a new way of analyzing DNA where you can basically, instead of looking at a single marker in someone's gene, you can combine up to 1 million markers, right, into a score, and then this score gauges someone's risk. And they've shown it to work really well. And I was telling her, pitching her polygenic scores. I said, you guys have to bring in polygenic scores. And then what they said to me was, risk stratification is not medicine. Right? You can stratify risk. You can identify that someone's at a 30% chance, someone has a 3% chance. But because a doctor doesn't know what to do, right?
Yeah.
Because there's no, evidence-based kind of care on what to do next, it's actually not very useful. And of course, that's something that I fundamentally disagree with.
Yeah.
I just think that's such a bad mentality because it all starts with risk stratification.
Yes.
It all starts then. You can start triaging downstream of what to do. And we can't, think, I think as a physician, obviously I'm not a physician, but I imagine as a physician, they want very, very clear guidelines. But medicine is quantitative. It's not qualitative. And I see this problem constantly. They say, what should I do or not do? Right? When really there's a massive gray zone. And what's happening now is they basically, instead of embracing the gray zone and actually giving people better care, they just, anything that's a little bit gray, they throw it out the window.
Right.
Right? If it's not 2% risk to 90% risk, we can't do anything about it. There's no evidence-based care, which is to me kind of crazy. But what do you think about that? I'm saying, what do you think? Yeah.
No, I completely agree. That's my main problem with healthcare as it is today. We think about risk all wrong.
Yes.
We wait
100%.
We wait until it is, like you said, almost certain risk.
Yeah, you're going to die. It's like, what?
Yeah. And then we're like, oh, we should do something about this.
Yeah, I agree. And that's what I mean when I say Hippocratic Oath, do no harm.
Mm-hmm.
In the process of trying to do no harm, in the process of saying, give me the evidence, tell me what to do next, it needs to be so clear cut, you do nothing.
Yeah.
You don't give the polygenic score. The patient never knows they're at risk for Alzheimer's, right? Alzheimer's is a great example because often, Alzheimer's neurodegenerative disease, there's not necessarily a clear next step.
Yeah.
But my God, if you're, at a 10 times X greater risk of Alzheimer's, I think the patient has the right to know that.
Yeah.
And moreover, I think medicine will get better.
Yeah.
And so if you actually know that you're at high risk for Alzheimer's, you can then start keeping up with the frontier of research to see what can I do to mitigate my risk. Because there already are some more classical lifestyle recommendations.
Yeah.
But I know for a fact medicine's only going to accelerate, especially in this age of AI. And if I had a 10x chance of Alzheimer's, instead of getting Alzheimer's as a 20-year-old, I'd want to know every single decade what's happening because it's a later onset condition, it's a chronic condition, it's one that I know I can make decisions today when it matters the most to change the ultimate outcome.
Yeah. Well, and I think Alzheimer's is a great one because you'll hear people say, like, why would you even check ApoE or Alzheimer's risk because you can't do anything about it?
Yeah.
And I completely disagree. We have not proven that you can't do anything about it because we haven't done the tests.
Exactly.
And if there is just a chance that exercising, doing HIIT exercises are going to help me not get Alzheimer's. Like I will add 3 HIIT exercises in per week if I know my risk is elevated.
100%.
Right?
And eating, exercise.
Yeah.
You know, there was a great analogy I think from Hyman. He said, like, let's say you get on a plane, okay, and let's say somehow you knew 6 months ahead of time that the plane was going to crash, okay, and you know. You probably wouldn't just, you know, be like, okay, I have 6 months period. I know in 6 months, you know, this plane again is going to crash. I mean, you'd probably learn how to fly a plane.
Yeah.
You know, like
Yeah.
you'd probably say, you know what? I have 6 months right now. I know this plane's going to crash. I'd probably, and it's not easy probably to learn how to fly a plane. And that's like how preventive medicine can actually be hard, right? People want a silver bullet, right? But like just like how you can't go learn how to fly a plane in a day. I love this analogy because it would take some time.
Yep.
But then guess what? It will save your life.
Yep.
Right. And so that's what I was thinking about in kind of the work you do, the work Nucleus does, we're bringing all these data pieces together. And even if there's not clear-cut cases today, the risk stratification is the foundation of this lifelong journey of preventing disease. Because it's similar to flying a plane, it's not like you can just solve it in one day. You know, people want, oh, yeah, it's true. You know, you have ApoE, E4, E4. Yeah, you can't resist Alzheimer's the next day. Of course not. But it kickstarts an entire health journey, entire process that you could, you know, get back a decade from your life. Of course you're going to invest in that.
Yeah. Well, even if you only had a 10% chance of preventing it,
it's your life.
It's your life. It's the only brain you have. Like I would do all the things that may have the smallest chance to prevent that disease. And
100%.
And you can only do that if you know your risk.
Yeah.
Like otherwise, like if you're blind to your risk, how do you know?
Yeah.
You just don't. And so that's what drives me crazy about, American healthcare and how we think about risk. We don't do anything unless we are really certain you're at risk. And we think of risk late in life when we should be thinking of risk, like you said, like when you're a baby, get that full genome.
100%.
And now we know risk. And none of it is like, I love the movie Gattaca. Do you know that movie?
Oh, how could I not?
Yeah. Like none of it is like predictive. Like we can't say what your actual phenotype will be based on your genotype. There are some things that are completely predictive, but they're not everything. But that being said, risk matters.
100%.
Like, and predictive value matters.
And it's up to the patient, in my perspective, if they want that data, they should be able to get it. What do you think about that? Do you think, you know, the doctor should be able to decide, should the doctor be the broker of someone's own genome or blood? What do you think?
No, absolutely not. I mean, bioethics was my minor in university. And so like autonomy of the patient to, you know, have autonomy of your body, your information, your data, 100%. You should be able to make decisions. And that's even how I approach care. Like if a patient comes to me and they understand all the risks and benefits of a drug and it's one that I don't think is unsafe for them and they're like, I really want to try this drug, I'm pretty much like, okay.
Yeah.
And I know some doctors would be like, what? I would not give a GLP-1 to that person. Or I would not put that person on testosterone replacement therapy or whatever. But if the patient knows all the risks and the benefits and it doesn't fall outside of something that's like grossly abnormal for me to practice, like I'm going to say, yeah, let's do it. And let's see how you feel and let's watch things and let's monitor things.
Agreed. 100% agree there. So one thing that you've said before is that the mission for you guys is optimal health, starting in the United States. Have you actually gone international? I'm just curious. Is there anyone like, no, you haven't? Okay. That was just a question.
I mean, I traveled outside the U.S. once.
Yeah.
No.
Okay. Another question for you is, what is a diagnostic test, lab test that you think is systematically underappreciated? Or said a different way, is there any innovation right now that you think could give people profound insight into their body? They just don't know about it. Anything like that?
Yeah, I mean, there are a few. I really think body composition.
Okay,
and
so like in body or something.
In body kind of sucks.
Kind of sucks. I knew you were gonna say that.
Electrical impedance, it's fine. Like if you don't have anything, I would actually prefer like fat fold testing.
Fat fold testing.
So that's like they use calipers and they pinch your fat on your chest, your belly, your arm, and they run calculations. That is more accurate than in body.
Really?
Yeah.
Where can I go to get that?
Most trainers are like trained to do it. Yeah.
Well, like, what is it? Like, what's like the result they give me?
Your percent body fat.
Oh, so they basically calculate your percent body fat, but instead of through electrical currents, they
do it off skin
by
folds.
literally grabbing you and like pinching you.
Yeah, exactly.
Really?
Yeah, and it's more accurate than
Are you serious?
in body. Yes.
I have never even heard this. This is a great answer.
Yeah.
Okay, give me more. Give me more.
So, but I wouldn't do that test.
Oh, okay.
I would do a DEXA if I could.
Oh, yeah,
Yeah,
right.
And people don't know this. DEXAs aren't even the gold standard. The gold standard is MRI, and DEXAs are an extrapolation of MRI.
Okay. What do you think about full body MRIs? Like Ezra or something?
Yeah, I am pro full body MRI.
Okay.
Like, it's all about data. And
data,
like,
right.
if patients want the data, and I know that there are many doctors who think they know what's best for society and for people, but I would say we generally don't. We don't know if full body MRIs are bad or good at a population level.
Yeah.
But I can tell you that a full body MRI could be good at a personal level if
Yeah.
we catch an early cancer.
Yeah. Hell yeah. Hell
Yeah.
yeah. And so do you recommend your patients, like through Bionic Health, they all get full body MRIs?
They don't all, but yeah, we offer, full body MRIs, liquid biopsies like Grail,
Yeah.
those types of tests.
And then, if, classic argument about full body MRIs is, they're great, but there's a lot of false positives. So,
Yeah.
a patient gets a result, it says, hey, this looks funny. They freak the hell out. They go to their doctor. The doctor does some, further testing. They say, oh, this is nothing.
Yeah.
And then they say, those damn startups.
And I say, that's great. Now we have a baseline and we know that thing's nothing. So the next time we get it, we can ignore it. And if something new pops up, we'll know.
And also it's just like, that's great news.
Yeah.
No news is actually great news.
Yeah.
That's another thing that I think is always interesting, especially in genetics. It's like, you don't have anything. That's great.
That's
Like
fantastic.
you could have had an 80% chance. You don't want 80% chance.
Yeah.
Right. And that's true with full body MRIs. Is there anything that you, as you kind of like, AI is obviously so huge and so kind of ubiquitous or becoming so ubiquitous. Is there anything that like you think for 2025 is going to be like for Bionic? Like, what's the year of Bionic?
Well, I mean, this last year was a lot of building.
Yeah.
And we built our own electronic medical record.
Really? Wow.
Yeah. If Epic owns the data, if some other EHR owns the data, then the patient doesn't own the data.
Hell yeah, I agree with that.
And so we built our own. And so this next year is going to be all about building the AI agents that are working for our patients kind of nonstop, looking at risk, looking at their data. And then it's going to be growth. We're spreading across the U.S. We're in 20 states now, just about to open up New York.
Love that.
So yeah, it's going to be growth and building.
Great. Well, Jared, it's been absolutely amazing having you on. Great to kind of connect all those months ago and to see both of our progress in the last several months. It's been honestly amazing. I think you gave some pretty kind of hot but well substantiated takes in this. I really appreciate that. I appreciate that you're a doctor, but even though you're a doctor, I think you're very kind of open to, this next wave of medicine 3.0. And I think you and Bionic more broadly are going to play a really critical role in building the future of healthcare.
Well, Kian, obviously, I love Nucleus. I looked for 2 years and I hired an expert. We have a Harvard professor that works with us. I looked at every company. There's a reason we chose to go with you guys. So we love working with you. So thanks for the conversation.
Thank you so much, Jared. Great. Thank you.